Hello and welcome to Community Matters, a podcast from the Canadian Association of Community Health Centres. I'm your host, Hilary LeBlanc. On this episode of the podcast, I am joined by Shannon Milks, Chronic Disease Coordinator, Michelle Kirkbride, Community Develop Coordinator, and Kristin Bergen, Director of Primary Care, all at the NorWest Co-Op Community Health Centre in Winnipeg, Manitoba. NorWest Co-op Community Health Centre's mission is to engage their community in cooperative health and wellness. Today, we'll be speaking about their work during the COVID-19 pandemic and the project that they were able to complete, made possible as recipients of the Community Vaccination Promotion Project, which was also made possible with funding by PHAC. How are the three of you doing today?
Great, thanks.
Good. Glad to hear. It was a lot of acronyms for me. I'm glad I got all that talking going at the start. Shannon, I'll start with you. If you could briefly tell us a little bit about your organization, the location, the services and programs provided, and the communities and population that you serve.
Absolutely. So at NorWest Co-op Community Health Centre, we are a non-for-profit health and social services organization. We are located within the Inkster community, so that is in the northwest corner of Winnipeg. So NorWest, we provide a wide range of health services. We provide medical care, we have a walk-in clinic, a variety of counseling supports, early learning and childcare, community development, employment supports, youth services, and food security programming. And we really look at services that address the many different determinants of health, really meeting people where they're at and providing care across the lifespan as well with all of our programs and services. One of the unique pieces about NorWest is we have multiple sites. We have many different locations. We offer a lot of outreach directly in neighborhoods within the community that we serve. We work with very diverse populations, many whom experience barriers to accessing care, systemically, racially marginalized populations. We have many newcomers, Indigenous families. We have people who live in lower income housing. So we really focus on outreach and responsive services to our populations and feel that that's really critical.
Amazing. You're serving everyone. I love that. Very important work as always. Michelle, curious, over the last 3 years, as we all know, the COVID-19 pandemic presented unforeseen challenges in all of the sectors, and the vulnerable populations have been one of the hardest hit groups. What was the impact of the COVID-19 pandemic on the community that Shannon just told us all about? And how was your organization able to navigate providing care and services to your clients during this very, very difficult time?
Yeah, it's a really good question. I think one of the things that sets us up is, as you mentioned, we're a community health center, and in particular, this community health center is a co-op. So because of that, we have a very collaborative ideology in how we plan for programs. And so when the pandemic hit and we had to shift really quickly, we were able to get all different people around the table, looking at how it was going to impact the clients that they're serving or the community that they're serving, and really come up with a plan that was going to make sure that our most vulnerable populations, like Shannon mentioned, were protected. So that might have meant that, we know when schools closed, the community centers closed, that actually also closed like lunch programs and breakfast programs. So we had to shift immediately to making sure we stayed open under protocols, but able to have door service where people could come and get their breakfast or their lunch because they were reliant on those programs. And so also the same thing, we set up information lines for people in domestic violence, and we set crisis lines, sorry, my voice is breaking, crisis lines for people who were experiencing domestic violence, because in those cases, it was actually still very unsafe for them sometimes to be home. So what could we do to support them during the time? We actually worked with primary care to make sure that our most vulnerable clients were still able to receive service. And we stayed open in our hardest hit communities. Like it might have been just for door service, but for people who didn't have access to technology, we partnered with Bell and we were able to give out phones or SIM cards, or set up what we called Zoom rooms so people could come in and connect with family and friends at home. They could connect with for counseling appointments. So that was a wide variety of what we did during the pandemic. And it was really important to even stay open for emergencies. So for people who didn't have a home or were experiencing a crisis that day, by following protocols, our staff were still there to be able to provide some support and resources. And I think that was really integral in keeping trust with the community through the pandemic, because so many other places were closing their doors, understandably so. And we kept them open to any degree that we possibly could. I don't know if Shannon or Kristin want to add anything with that, but.
Either of you? If not, I will add
Go.
that
Okay.
it is a thorough line through and through all of our podcast episodes that CHCs almost continuously, they did not close their doors.
Mhm.
They were there bridging the gap when no one else could. I've heard so much around digital equity innovation, getting those phone partnerships. And so kudos to the amazing work. It's my favorite part of the podcast is hearing all the inspiring stories. Shannon, I did want to ask, and part of these inspirational stories, NorWest was one of the recipients of the CVP-National project, as mentioned, a PHAC funded. Could you tell us a bit about what your project was and its goal, and include any activities or programs that were carried out?
Yeah, so our main goal was really to provide vaccine outreach within our community. So community-based vaccine clinics at a variety of locations that were accessible, that were easy, that were sort of no barriers in terms of being able to access that vaccine. And so because of NorWest having a variety of locations, this is where we, again, partnered with our resource centers, for example. So NorWest, so as a community health center, we are located within Access NorWest. That's sort of our main site. We also have resource centers, though, directly in some of the different neighborhoods that we serve. And so we offered those vaccine clinics right in those resource centers. We have a NorWest Community Food Center, so we would actually send our team right in to those sites and work with the team members that were already providing programs and services out of those locations and offer vaccine clinics with our own team members, helping through the process, greeting, helping out with forms, having a familiar face, greet people and have walk them through that process was really important because at a lot of those sites and within NorWest, we have those relationships within our community and there's that trust there as well too. So that was really important. We also, in offering the vaccine clinics, we allowed people to come and walk in. So it didn't have to be a scheduled appointment. So we had a bit of a hybrid of both. We also didn't require people to have their Manitoba health card to be able to come in as well. So in terms of overall what we were able to offer from fall of 2022 till about spring of 2023, we had 13 different clinics that were offered and we offered just over 300 immunizations. We also even paired offering the COVID booster vaccine with offering the flu vaccine. So people were able to get both all at one time. So just sort of one-stop shop for people needing those immunizations. And we found that to be really helpful for people as well. And again, improve that access.
Amazing. What were some of the milestones and achievements that were able to be achieved during the project?
Well, really just collaborating with other partners. We did a lot of social media as well. So social media creation, creating some frequently asked questions and sort of easy to understand language in terms of why to get the vaccine and who was eligible. And that was ever changing. So keeping up with that information. Just being able to pair the vaccine clinics with other events and things that were happening in our community. So if there was already a food program happening or a community lunch, if there was crafts or bingo, sort of adding on to that and being able to offer it around the same time where we already have an engaged group that's participating in an activity, that was definitely something that was a lesson learned. Having the walk-in option, having the site be easy to access. We also found that who was offering the vaccine was key as well. So we used our own primary care nurses to actually administer, again, being a familiar face for a lot of people in our community. Having a lot of leaders within the community help us to promote. So the community development team, for example, will work with a lot of individuals that are coming and frequenting those resource centers and know the community and would sort of text message or pull people in and let them know what's happening. So really partnering with a lot of those community leaders. And one of the biggest things too was offering food. So making sure that we had food or snacks or even vouchers for some of our markets available as a bit of an incentive as well to help people. Those were some of the things that we definitely found were useful. And just making sure that looking at the flow of the clinic when someone is coming in, what does that all look like in terms of who's greeting them? What's the process of walking them through from, just filling out the forms that might, be required for the vaccine to actually receiving their vaccine and then sitting there waiting, having familiar faces and having it be a really seamless process was really, really helpful too. So those were some of the milestones and lessons learned.
Great. Kristin, so what were some of the challenges and barriers to vaccine promotion that you and your team experienced in terms of the uptake within your community? And then how were you able to manage those challenges?
Yeah, I mean, I think one of the challenges, particularly in this phase of the pandemic with vaccine administration, is similar to what we've been seeing across, I mean, not just Canada, but everywhere, is that there's a bit of initial vaccine hesitancy, but also a bit of fatigue around vaccination, and people feeling like they might have had some vaccines or not really understanding why it's important to get a booster or pieces like that. So I think there was a lot of pieces that we did, again, using social media, interactions with clients that we have on a regular basis through all of our different services to help educate and give opportunities to learn about why those types of things are important, and why we would encourage them to come to those types of clinics. As an organization, there's also a lot of competing priorities where we had some staffing challenges. I mean, still dealing with people being away sick and not having enough staff to always cover, and competing priorities as we're trying to re-engage in a lot of the other programs that were not happening during the pandemic, but getting back to normal in some of those things. So trying to make sure that we have all of those things happening. We also had things like STDVI clinics running, and we are shifting to more having our teen clinics. So trying to make sure that we're able to do all the pieces again and having this build in. So this funding particularly helped us to have some of our outreach staff go out into the community and have some extra funds available to shift people, have people pick up some extra shifts and work some extra hours, so that we were able to have people and not just be working short staffed all the time, and also make sure that when we were planning the clinics as much as possible, that we were able to show up for them. We also know the importance of, especially with these communities, when we say we're going to do something, we really want to make sure that we're following through on that and building those relationships. So that's something that we were able to do with this funding, which was really great. Another challenge, which for those who don't know, being in Winnipeg during the winter months is a challenge, to say the least. And so people tend to hibernate within the winter months for good reason. Me being one of them, and I have a lot of resources at my fingertips. So it's harder to get people engaged. There was things that we were able to do when we run in the warmer months, like have food trucks and things like that. And it's easier to get people who are out and about, and people aren't quite out and about as much. So trying to, again, use the programs and services that we have that are running anyway and engage those clients as much as possible. And then just kind of keeping up with, you know, although the changes aren't quite as fast and furious as they were at the beginning of the pandemic, there still are a lot of changes in terms of like who should get which types of vaccines, and trying to ensure that people understand that, but also ourselves keeping up with that and adjusting to the changes as they come. So I think those were some of the main challenges we faced.
Amazing. Michelle, you did mention before a little bit briefly in terms of digital equities, talking about Bell. I was curious if your project involved any other partnerships or collaborations, and if there was any relationships that you leveraged to ensure the delivery of your vaccine uptake project.
Yeah, absolutely. So like as Shannon mentioned, in the first phase, there was obviously more urgency. So I think we had quite a few new partners in the first phase, including Dr. Marsha Anderson out of Manitoba Health, leading kind of the Indigenous focused vaccine strategy, and groups like the, I'm not going to say the name properly, but it's the Ethnocultural Vaccine Working Group, looking at different players across the city who were coming together and looking at ways we could get into the more at-risk communities. But in phase two, we kind of leaned, I would say, more on our established partnerships. So schools were back open again. Public health was back kind of in person doing their vaccinations. Our community food center was running in person lunches again. Our community centers were open, and our resource centers, as Shannon had mentioned, were also running and operational and open. So we really wanted to go in that second phase of where people are most likely to go to get another service and kind of partner on. So if you're going in for lunch that day, because we know food security is a big issue, especially post-pandemic, even more so, we would leverage using kind of multiple events to kind of promote vaccines. And so if you, so you could be going for lunch and getting your vaccine, or we could be spreading it throughout the schools, partnering with public health. They'd be doing the flu vaccine, we'd be doing the COVID vaccine. So the vaccine clinics were on the same day. and really working with those community leaders still to kind of get the information out and make sure that people knew about it and if they had questions. And I think that's the big thing that I really took away from our partnerships, primary care and community development in particular, which is community development is in the community every day. So is primary care, but in a different format, right? So we're in the communities every day and we're building those relationships. So we can get the people to the sites, but we can't answer questions about vaccines or hesitancy or any of the other things that are coming up. So by really partnering with our primary care team and public health, they were able to actually do that and not just there and like come in and get your vaccine and leave, but they took the time to answer the questions and to really find out what people's concerns were so that we could address it properly. And I think as we go forward, one of the lessons I think was really important was making sure that that time frame was built in. I went to our super centers and that was not built in there. And I understand why not, but I do think that that was a competitive advantage we have when it looks like why are we more successful at getting out to some of those more at-risk communities.
Yeah, absolutely. Definitely makes sense dismantling that vaccine hesitancy, misinformation, all of these aspects that made people so afraid. I know people in my family, in my communities had some similar questions, and I just do the communications. I do not have all of the answers. So it is important to get those people with the right answers. And along the lines of speaking to the relationship building, I'm curious if you guys were able to work with peer ambassadors or community connectors, and if so, what specific challenges and successes came along with having that as an added bonus as well.
Absolutely, and as I mentioned, this was both phase 1 and phase 2 that we worked with the Ethnocultural Vaccine Council of Manitoba, and we were able to leverage a lot of peer navigators, especially in the first phase, where we knew that there would be language barriers to understanding what the vaccines are about, or just, if we're going to be honest, systemic racism has played a part in maybe not really trusting the healthcare system. So being able to combat that by really leaning into who those community leaders are. And so we were able in the initial phase to translate our information into 17 different languages, get that information out there. But I think in the second phase, and we use those ambassadors to actually give that information out to their community and to be the face of vaccine awareness within their community, and that was quite successful. I wouldn't say it was as formal in phase 2, but we actually still did rely on those community leaders and those peer ambassadors in a more informal capacity. So when we were going to have a vaccine clinic at a resource center, it's not just the community development staff who were talking about it. We still leaned into who those community leaders were because they have a different role within their community, right? People know them and respect them as their neighbor, and they're often more successful than anybody else at getting people out because they trust someone from their community in a way that they just can't trust a system. So I think that's really important. And I think no matter how we go forward, we're not going to lose that model, because I think anytime we're talking about a health issue, we have to really give some kudos to those community leaders, because they're going to have access in a way that we can't. So it's about arming them with the correct information, and we're still using them, just like I said, more informally.
Amazing. With new variants and the approval of booster doses, Shannon, I'm curious what that effect has had on the work that NorWest Co-op has carried out, as well as specifically through the CVP-National project, and how you continue to adapt to this ongoing public health issue, because we're still not completely out of the woods yet.
Well, and it's always changing, it's always adapting, it's always shifting, right? And so I think, as Kristin had mentioned in our challenges, so with new variants and you're learning about it, and it's trying to keep a lot up to date, right? With what is the most credible, accurate information? How do we also take that information that we receive in our memos and through our resources and create that and make it meaningful for community, and really in ways that will be able to understand why it's still important to continue to protect yourself, right? And so really just keeping up to date with the changing information about who's even eligible for the boosters. What are those boosters? What's available? What are we ordering? What are we making available to our community? So that was really just where we have working groups. So actually there's lots of, one of the things that we did within our own project is we have a steering committee, and we have a variety of reps from all of our different sites, and we get together regularly and we talk about what are the challenges, what are we hearing from community, what are you seeing, what are the needs, and really just adapting our strategy and our process to that. And part of it was really around creating some social media messaging around what the new vaccines are and who's eligible for those boosters and where we're offering those clinics and that kind of a thing. So we have found in the last few months when we've been running our clinics, we have sort of scaled them down a little bit. So in our first phase, we were offering clinics at community centers because we had lineups of people, right, coming and getting their first or second dose and then potentially their booster. Now, because we found that more people have already got their booster, or maybe they're ready for that last one, but they're not eligible yet, right? And so we definitely sort of had to pare down and sort of streamline our processes and our workflows around that. And the clinics now are generally a little bit smaller, and a lot of people have had their booster. So it's really just now trying to find who hasn't, right? Who are those harder to reach populations that still need to get that booster, and really working with the teams. And that's just an ongoing thing that we'll continue to work through as an organization.
Absolutely. And how has the funding through the CVP-National project helped your center and community it serves in a more broader scope now that the project is, coming to a close?
Yeah, I mean, the funding is always helpful. I mean, those incentives, having food always available. We also have like markets that we have where we offer fruits and vegetables, for example. And so we were giving vouchers for that as well. If you come and get your vaccine, so there's those things are always a draw for people and a way to get people through the door as well. So had we not had the funding from CVP, the national project, we wouldn't have been able to do that. We also had communication support as well, so that the funding also helped in development of some of the social media content. And keeping that ongoing and staying up to date with the information and continually posting. So we're very thankful that we were able to have that funding, and it definitely supported our efforts and it was put to good use. So thank you so much for that.
I feel like I need to say you're welcome, but I just report about the good work everybody got to do because of the funding. I did not sign it off on anything, but I'm so glad about the work that gets to be done. Kristin, what are the next steps for NorWest Co-op after the CVP project with regards to COVID-19 and your collective hope for the future?
Yeah, I mean, I think just it's kind of sort of business as usual for us as a community health center, in that we are just going to keep responding to the community and adjusting to the changes that come with, the pandemic and the different variants and different mandates, or I shouldn't say not mandates, but recommendations for vaccination and what those vaccines look like in the future. I think, we still will continue to ensure that we are reducing barriers for people within our community and helping people to feel like that is something that is applicable to them, and just even working on vaccine hesitancy overall. It is something that there's a few things. So during the pandemic, we did see that other vaccination uptake really declined for a variety of reasons. But then also just like re-engaging with those communities about the importance of vaccinations in general, including the COVID vaccination. I mean, I think we sort of see it that it'll just become part of one of the vaccines that we're offering within our regular services. And so just trying to figure out how that looks within the organization. And then I think just continuing, I think the advantage of being a community health center is we do have the ability to be innovative and nimble to respond to the things that happen and quickly. So I think just continuing to do that work together is where we're hoping to go from here.
Absolutely. And what do you think your experiences throughout the pandemic say about the ability of community health centers to adapt to emerging social and public health issues, and the importance of community health centers within our health and social service system?
I mean, I think sort of building on what I was saying before, is that I think the advantage of a community health center is that we are able to move a lot more quickly than some of the bigger government organizations or other just organizations in general. We have a little bit more flexibility, and we are already connected so much with the communities. And so I think the success of this type of initiative really draws on our traditional strengths and the existing relationships that we have within communities and other partnerships that we have. And I think using that collaborative approach between primary care and the work of community development is really where we are able to amplify the success and have really a lot better outcomes than just working on our own. We also are able to move quickly with these initiatives with other community partners, and we have already that trust and relationships within our community. I think just thinking about the trust and relationships is really key. We know that we're serving populations which are, a lot of people are racially and structurally marginalized. And so having that trust is key for us to be able to do any of the work that we're doing. And particularly when there's these emerging things, having that baseline is really important. And I think it was really part of the reason that we had those successes and that people did feel comfortable coming to us and did look to us as a source of information and a place that they could have trusted sources. And I think that was a really big factor in our success as well. And just the success of community health centers in general. I think, again, just with community health centers, we're able to operate a bit differently than, like if you think of like a standard hospital or a primary health center, where it's maybe a little bit more clinical, which can be a big barrier. We also have multiple locations. So for example, we have a fairly small geographical area that we serve, but we have really distinct community groups within that. So we have resource centers and we have other clinics and locations that are right within those communities, so that it's within walking distance. It's within the areas that people are already living and moving around. And so we have those abilities to continue to provide services right where people are and meeting people where they're at. We're also more flexible in like the hours that we work. We don't require all of the same check boxes all the time. So, if someone shows up without ID, we work with them to try and figure those things out. And then we do provide a different space and that time where we take time to work with communities to provide culturally safe spaces, as well as places that are family friendly. So if childcare is a challenge, then you can bring the whole family, and we make sure that there's other activities and events, and they're also getting more than just that one need met that day. Shannon mentioned the food that we provide, and so that is often something that is really helpful for families and other community members. So I think having all of those coordinated efforts and using a collaborative approach, which is the foundation of who we are as a community health center, is really what makes community health centers and NorWest particularly situated in such a good space to have these types of successes.
Perfect. What a wonderful answer. I want to thank the three of you so much for taking the time today. I will say briefly, you guys were so organized. If anyone had any additional comments before I ask where more people can find you guys, wanted to give you guys the opportunity to add anything else just in case, because I sort of speed rolled through all of those amazing questions about your project.
Yeah, I'm so glad you did. I'm so glad you did. You can actually find us. We have a website. It's www.norwestcoop.ca. But we also have a very active social media presence on Facebook at NorWest Co-op Community Health, or on Instagram at NorWest Co-op, all lowercase, or on Twitter at NorWest Co-op, capital N, capital W, and capital C. So you can find us there.
Perfect. Amazing. Thank the three of you so much for coming on and taking the time to chat with us about your project today. I'm so happy with all the work that got to be done. And it's weird to see this project slowly coming to an end, like the full 2 years of the CVP-Project. But congratulations on the wonderful work. And I'm sure in some capacity, we will be talking to NorWest Co-op again soon. Thank you so much.
Thank you.
Thank you. Have a good day.
Bye-bye.
Thank you for listening to Community Matters, a podcast from the Canadian Association of Community Health Centres. To learn more about our association and the important work of community health centres across Canada, go to www.cachc.ca.